Have you been thinking about doing hormone replacement therapy or HRT, wondering if it's really for you, and maybe still have a lot of questions? So, today we're going to tackle some of those more common questions that women ask when they start seriously considering hormone therapy. First question: can I take HRT if I have a family history of breast cancer? So, a family history of breast cancer doesn't automatically mean that HRT is out of the question. Now, a personal history is different. If you've had a hormone sensitive breast cancer yourself, that's an important factor to weigh with your provider. You want to make sure you find a provider who has experience with the HRT and can help you look at the full picture and make that decision. So, another question I hear: will HRT help with brain fog and mood? So, it can. Estrogen plays a big role in how the brain works, which is why women notice shifts in their mood, memory, focus, and emotional resilience during perimenopause and menopause. Now, if hormonal changes are contributing to these symptoms, HRT may help, but not every case of brain fog, low mood is strictly hormonal. Sleep, stress, and nutrition and overall health factor in too. So, HRT can be part of the solution, but it may not be the whole solution. Next question: how long does it take to work? So, that's really going to vary from woman to woman. Some women feel improvements in hot flashes, sleep, and mood within a few weeks. For others, it may take a few months to fine tune the right dose, delivery method, or combination of the two. And when I talk about delivery method, there's the patch, the oral pills, vaginal cream. So there's different ways to do that. So that's what delivery method means here. HRT isn't usually a quick fix, it's more of a process of finding what works best for you. On another note here, there are many symptoms that are related to perimenopause, menopause, and we don't even know that they're part of that. And you start taking the HRT and they go away, and we've never connected them to what's going on in the first place. Next question: what side effects should I experience? So, most side effects, if they show up, usually happen early as your body is adjusting. Some women notice things like breast tenderness, bloating, headaches, spotting, or mood shifts. And often these side effects fade or they can be improved just by adjusting your dose or your delivery method. If something doesn't feel right, don't assume you have to just stick with it. Often, small little adjustments can make a big difference. And the last big bad burning question: how long can I stay on HRT? So it used to be about stopping at a set number of years, but that's not how it's approached anymore. Now, menopause specialists look at how you're doing over time, weighing the risks and the benefits as they evolve. Some women use HRT for a few years, others stay on it longer. But the key is regular check ins to make sure the benefits are outweighing the risks. So, you've probably noticed there really aren't many simple answers, yes or no answers when it comes to HRT. And that's because every woman is different and how their body responds to it. And her symptoms, her health history, concerns, and goals are all different. So the goal here isn't to find the right answer for every woman, but it's to find the right answer for you. And part of that is understanding your own patterns. So, tracking your symptoms, changes, and questions can make a huge difference, especially if you're trying to decide if HRT is right for you or whether it's helping the way you hoped it would. So, tell me, what is your biggest, baddest burning questions about HRT? I'd love to answer that for you. And remember, you get to do menopause your way.